Around 40.8 million people worldwide are living with HIV today. Despite decades of progress, the epidemic continues with 1.3 million new infections recorded in 2024 and millions still unable to access life saving medicines. HIV remains one of the deadliest pandemics in modern history. AIDS, acquired immunodeficiency syndrome, is the final and most severe stage of HIV infection. It develops when the immune system becomes so damaged that the body can no longer fight off infections and diseases. AIDS is not a virus, it is a condition caused by HIV, the human immunodeficiency virus. Once inside the body, HIV targets the immune system's command center, the CD4 cells or helper T cells. These cells coordinate the body's defenses. The virus fuses with the CD4 cell, inserts its genetic material, and hijacks the cell's machinery. The infected cell becomes a factory producing more HIV. Over time, these new viruses burst out, infecting more CD4 cells. Years may pass silently, but the immune system steadily weakens. When CD4 levels fall too low, opportunistic infections take hold. That is when HIV progresses to AIDS. Soon after HIV enters the body, some people experience flu like symptoms: fever, headache, rashes, swollen lymph nodes, diarrhea, and night sweats. But these early signs often fade, and many mistake them for seasonal illness. For years after, HIV slips into a latent phase. No symptoms, no warning. Yet the virus continues its assault, slowly weakening the immune system. As HIV progresses, the body begins to signal distress. Constant fatigue, unexplained fever, rapid weight loss, persistent diarrhea, oral infections like thrush, shingles, and pneumonia. These recurring illnesses mark the turning point. Without treatment, the immune system reaches its breaking point. CD4 counts fall dangerously low, and that is when AIDS is diagnosed. AIDS represents the collapse of immune defenses. At this stage, even minor infections can become life threatening. People with AIDS face opportunistic illnesses such as tuberculosis, severe fungal infections, and certain cancers, diseases rarely seen in healthy individuals. HIV spreads through specific bodily fluids: blood, semen, vaginal and rectal fluids, and breast milk. Transmission occurs through unprotected sex, sharing needles, infected blood transfusions, or from mother to child during childbirth or breastfeeding. HIV does not spread through touch, hugging, sharing food, or everyday social contact. The risk of developing AIDS rises when HIV goes undiagnosed or untreated. Those with multiple sexual partners, untreated sexually transmitted infections, or who share needles face higher chances of contracting HIV and therefore a higher risk of progressing to AIDS. Once AIDS develops, complications multiply. Wasting syndrome causes severe weight loss. HIV can affect the brain, leading to confusion, memory loss, anxiety, or HIV related dementia. Kidney and liver diseases become more uncommon, especially in people also living with hepatitis infections. Diagnosis begins with HIV testing using blood or saliva to detect the virus or its antibodies. If confirmed, doctors track two key markers: the CD4 count, which measures immune strength, and the viral load, which shows how actively the virus is multiplying. Early diagnosis is crucial as timely treatment prevents the progression to AIDS and reduces transmission. The greatest breakthrough in the HIV response has been antiretroviral therapy. These medicines block the virus from multiplying, allowing the immune system to recover. With consistent treatment, the viral load becomes undetectable, which also means untransmittable. In many countries, ART is available free of cost through public health programs. This year's World AIDS Day theme, Overcoming Disruption, Transforming the AIDS Response, calls for closing funding gaps, rebuilding global cooperation, and protecting the rights of people living with HIV. The world is being urged to act now if the goal of ending AIDS by 2030 is to remain within reach. Prevention remains the strongest defense. Regular testing, safe sex practices, clean needle programs, awareness of transmission, and consulting a doctor about preventive medicines like PrEP and PEP. AIDS is life threatening, but with awareness, timely diagnosis, and consistent treatment, it is also preventable. Harshita Oberoi's report for Wellness Watch, DD India.